Now, we've got Dr. Maymunah on standby for us. Now, Maymunah Mustafa is a multiple award-winning mental health physician and advocate. She's also a consultant neuropsychiatrist and a founding member, Employees Assistance Professionals Association, that are providing toll-free counseling to patients of COVID-19, caregivers, frontline workers, and their relatives for holistic wellness. And she's joining us this morning via Skype to talk to us about something really, really important. And first, about this selfless act of service, and also how people can take care of their mental health during this period. Dr. Maymunah, thank you so much for joining us this morning.
Thank you. Good morning, everyone.
You look very nice and sprightly. I like it. It's really nice.
Thank you.
Now, this is a selfless act of service. Employees assistance. You're talking about mental health. Could you just give us a background on what this is about and how people can access your services?
Holistically, when managing any medical condition, there's always a biopsychosocial model to it, which then means that the biological aspect, which is what we are doing right now, screening, ramping up screening, confirmed cases, and that's why NCDC keeps letting us know the number of cases, and of course the World Health Organization on a global scale. On the social part, we see a lot of government trying to give relief materials, food, helping the citizens of any of their nation in putting things in place. But the missing link here is the psychological, approach and the psychological support. Even last week, the United Nations already telling us that if care is not taken, mental health issues will be abound. And when you look at it globally, a lot of times, the frontline health workers, or the people that really are doing the work, people just assume that they are just fine. That is their job. Actually, that is their job. But of course, we do understand that they need a space to decluster, a place to debrief their mind, a safe space where they can also talk about their fears, their confusion, because these people have loved ones. So as an organization, it's a global organization, but we have the Nigerian branch since 2015 that has been registered with the corporate CAC here in Nigeria, the Employees Assistance Professionals Association. These are a group of counselors, psychotherapists, psychiatrists, and of course psychologists. So we came together a month ago and we told ourselves we have to just do our own bit in our own little corner and help people out. So what we've done is to get our colleagues together on a volunteer basis with a well-structured roster, and we've deployed 10 toll-free lines that we are using. And so on a daily basis, Monday to Sunday, we have trained professionals that are mounting these toll-free lines, minimum of 5 to 7 people on a daily basis. And the calls have been coming in from the health workers, from their relatives, from their caregivers. And we just want Nigerians to know that this service is available. You don't have to pay. It's free, and it's being mounted by professional and trained counselors, psychologists, and psychiatrists.
Wow, thank you so much for what you're doing. I mean, this is like you said, it's a selfless act, and I hope that you even get more support so that you can expand the service to others as well. Now, we'd like you to give us a sense of what professionals working on the front lines, give us a sense of what they actually go through psychologically that makes them need this kind of help. Because sometimes, like you said, people think, oh, you're a doctor, you're just doing your job. Why should you be affected mentally by this? Just give us a sense of what they face on a daily basis and why this affects them mentally eventually, especially when it's prolonged like this.
Yeah, so frontline health workers are also humans like any other person. But for the fact that they are trained to do what they have to do, they can't afford to relent. So even using myself on a daily basis, I have to go to work, but I have a family. So every day you step out to go to work, your family members are afraid. They're telling you, be careful out there, don't get infected. And of course, when you come back, you have to take all the precautionary measures, jewelry, shoes, and all that. So the healthcare workers are also frontline, especially. They are afraid. Anybody that walks into the hospital right now is COVID-19 until proven otherwise. So you have to take extra precaution to make sure that you don't get home and they are telling you that the patient you just saw now, 2 days later, the result is positive. So there is fear, there's confusion, there's heightened anxiety. And let's not forget, people die. We do know that people die, especially if they are doctors. We certify patients every now and then and say, look, this person died, primary cause of death, secondary cause of death. But the truth is that we now see people that, walk in healthily, and maybe for some reason, underlying medical condition, you have to certify this person and all that. So all that death rate, we are lucky. In Nigeria, we don't really have that. But of course, we still know that people do. Let's take, for example, the people that deliver, the women that are positive COVID-19, and they have to have babies. So you can imagine a surgeon and an anesthesiologist in the theater, when you already know this person is positive. And of course, any mistake you make, it can also affect yourself. So it's just that fear, that confusion, that heightened anxiety. And let's not forget, some weeks ago, one of the notable doctors that was managing patient in the emergency room killed herself. So we can also get depressed and be suicidal, but we just have to put up that front that all is well, but truly it's all really well. But with this kind of support, they can offload their mind. They know the place is safe enough for them to talk. They know they wouldn't be judged, they wouldn't be criticized, and of course give them that reassurance that all will be well. And if you do all the necessary things, precautionary measures in place, keep doing what you're doing, you'll be fine. So for us, everything that is happening to any normal, regular human being out there also happens to this doctor or a pharmacist or a nurse, but even more, especially when you are directly dealing with people that are positive, not people you think are positive. So our anxiety and sometimes the depressive feelings, and of course changing eating and sleeping pattern, because you are scared people that you met during the day. When you go to sleep, what if tomorrow your test comes out and it's positive? So all that clouds your emotions.
It's quite a lot of pressure on the doctors. Now, just to round off now, I know you've already started this service. You have about 7 to 10 lines. What do you need to expand this? Do you need support from the general public, corporate organizations, the government? What else do you need? Because if you're talking about these particular challenges, obviously you're going to have a lot more calls than you can handle over the next few days into weeks. So what else would you need?
We need everybody on board. Now we are just focusing on the healthcare workers. We need the government to even know that this is even existing. We need the general public to even know that this is existing. And of course, if we can get support from corporate organizations like the telecoms, if we can get more lines, and then we get more volunteers from outside to come on board to support, because truly the government can't do it alone. But if all these things are put in place, and of course with the volunteers behind the scene, we can actually deploy the service effectively, and it can it can go on a nationwide coverage.
Well, thank you so much, Dr. Maymunah, for what you're doing, for giving back to society, and of course to your team as well for doing a great job supporting our doctors in the mental health. And hopefully we're going to have even more testimonials of impacts that you're making. Thank you so much for joining us this morning.
Thank you very much.
All right, there's more on Wake Up Nigeria after this break.